As the nation continues to deal with COVID-19, the U.S. Department of Veterans Affairs is creating and implementing new innovations to serve our veterans. Through its innovation ecosystem, VA employees are able to take local ideas and develop them into national programs, specialized services, and critical equipment to help veterans, families, and more. Here with more is Dr. Ryan Vega, the Executive Director of the VHA Innovation Ecosystem. Good morning. How are you?
Hey, good morning. Thanks for having me.
Thank you for being here. All right, what is the VA's Innovation Network and how does it directly help veterans?
The VA has enjoyed a long tradition of being a leader in healthcare innovation. And several years ago, we continued to embrace that tradition and created a network bringing together VA medical centers and frontline employees across the country, not only to learn from one another, but really to help ensure that solutions that were developed at one VA medical center had the opportunity to spread and scale quickly in service of all the veterans that we serve. And the Reno, Nevada VA Medical Center has played a really important role as a leader in that network for the past couple of years.
Good to hear. Can you tell us more about the VA's 3D printing technology?
Yeah, absolutely. This is just one of the amazing examples of some of the efforts that this network has really helped advance over the past couple of years, but really in light of the pandemic. You know, 3D printing is a great technology in healthcare. Just like if you were to imagine a Word document on your computer that's printed, the printer just creates a layer of ink to make a replica of that document. Well, in the same way, we can do that in medical imaging. So if I think of a CT scan and I'm looking at a patient's lung or a patient's heart, I can send that image to the printer and just recreate that anatomy. So this is actually the replica of the blood vessels of a patient's liver, and I can hold it and I can actually work with the veteran to understand maybe a procedure or a surgical operation coming forward. But likewise, our surgeons can actually help prepare for surgery unlike ever before. Well, this technology became really important in VA medical centers across the country during the pandemic. It allowed us to produce necessary PPE or testing equipment such as swabs that were in low supply that we were able to get back into the hands of our providers to care for veterans.
That is so incredible. The technology is fascinating. Can you explain how the Podometrics and rideshare programs also help veterans and their families?
Yeah, sure. Podometrics is an initiative we're really excited about. We call it the Initiative to End Diabetic Limb Loss. And think of it as a thermometer for your feet. So this is a floor mat that veterans will stand on, and what we're looking for is whether the foot has a fever. And I know that sounds kind of silly, but what that tells us, if it does have a fever, is that this veteran's at risk for a diabetic ulcer formation, right? And we can intervene weeks before the human eye could ever detect that ulcer forming. But what's even more important was during the pandemic, this idea of being able to manage chronic diseases at home was significantly interrupted. Either clinics were impacted during operations or veterans themselves didn't feel comfortable coming back into the hospital. This technology allowed us to remotely monitor these veterans at home, continue to give them the opportunity to be an active participant in their care, and do so all in a safe and effective manner. And the rideshare program that you mentioned real quickly, this was an initiative that folks had started to help get veterans to and from their appointments. Well, those appointments got canceled come March, April. And so instead of just letting the pilot go, they repurposed it and they used this initiative to help get veterans food and other goods or materials such as paper towel and toilet papers to veterans' homes. So they never had to leave their house, or perhaps they were relying upon services that were no longer operational.
Oh, wow, that's great. So how is VA supporting pandemic efforts and frontline workers through these programs?
Yeah, we have two different initiatives that we have going on. One, going back to that 3D printing, we have a partnership with FDA, NIH, and a non-for-profit called America Makes, where VA is playing a really central role in helping to evaluate and test a lot of the designs that are coming from all over the country, not just VAs, but academic partners, even folks that do 3D printing as a hobby. And we make that information publicly available, and America Makes helps to sort of bring folks together to actually manufacture a lot of these designs at scale. And according to their latest numbers, about 1 million different products have been put back into the community in the hands of frontline workers who are caring for patients all across the country.
All right. Well, where can viewers go to find more information?
Sure. So va.gov VA.gov/innovation ecosystem. You can learn more about a lot of the amazing efforts going on. We have a virtual experience coming up in late October where folks can tune in. It'll be live anywhere from across the country. We'll have employees as well as industry partners talking about some of the transformational work going on in the VA.
All right. Well, thank you so much for your time and insight.
Yeah, and my New Orleans Saints play in Las Vegas tonight, so I got to leave you with a who dat.
Okay, well, I've got to go for my Raiders, but thank you so much. All right, from identifying problems to creating solutions for veterans. For more on the VHA innovation ecosystem, head to the website on your screen. The U.S. Department of Veteran Affairs is a proud sponsor of Las Vegas Morning Blend.